occurred was mostly due to the early establishment of several intervention strategies very early on in the outbreak, including the establishment of the Central Epidemic Control Center, Command Center, and followed by a series of prompt intervention strategies, including border control and screening, active detection of cases and containment, and resource allocation. Taiwan, the Chinese government, also leveraged our existing healthcare system for data and epidemiological analysis. Many of these are highlighted in the paper that was just published rather recently in a JAMA article by Dr. Wong and co-authors. You may also refer to this paper if you're interested. We have provided a link on our Facebook page. Our goal today, both locally and globally, is to link together different experiences from Taiwan and Boston so that we can actually start a conversation about Taiwan's outbreak preparedness and its role in global health. Together, we can join together different experiences and actually find a common battle. And so today's sessions will be separated into roughly 3 sections. I will start each session by introducing the topic and speakers, and they in turn will lead and guide through the sessions. A quick note on our technical, how we set up our full discussion today. Everything will be linked through Zoom, so if we apologize in advance if there's any lag or any technical difficulties, we have great tech support that will right there. And so if that does occur, please be patient. Also, every session will be roughly 20 to 25 minutes long, followed by a 10-minute time for discussion and questions and answers. When people will provide you with, our staff will provide you with a microphone should you have any questions. Please try to mention whether you're directing that question at a single speaker or all the speakers in that particular session. We originally there will be 2 public health officials from the Boston Department of Health with us today. Unfortunately, they cannot make it as they are responding to the recent developments of the disease in Boston locally. But so without further ado, let's just dive directly into our first session, which will be touching upon what Taiwan learned from this 2003 SARS outbreak and how we improved from those lessons to respond to the outbreak that we are facing today. The session will be led by Dr. Chang-Chuan, who is the Dean of the School of Public Health at National Taiwan University and a leading expert in environmental, industrial, occupational health, and international health, as well as Dr. Hsien-Ho, who is also a professor of epidemiology and preventive medicine at National Taiwan University. He also developed methods and epidemiological research in regards to infectious disease. So let us please welcome Dr. Jong and Dr. Lee.
Okay, can you hear me? Good. Good afternoon, friends in Boston. It's great to be with you, and especially under this great threat to the global health. And today, I just want to give you certain points, what the backgrounds and some of these achievements we have achieved so far in containing this COVID-19 in Taiwan. Until now, you know, if we are thinking of the scale of the problem we are facing today in terms of these new cases and the deaths, COVID-19 is much more serious than the SARS Taiwan has experienced back in 2003. And people in the world are wondering why Taiwan this time can perform so well until now. And I give you some of explanations I observed. First of all, through the years, people in Taiwan, especially professionals, are very cautious of the diseases outbreak from China. So in 2003, even though the whole world is not aware of SARS, but in Taiwan, because of some of Taiwanese businessmen has many operations in China, and they have already conveyed back to Taiwan some kind of a news about mysterious diseases. That is kind of a disease they cannot explain. They saw their workers suffers back in November 2002. And we only know about these diseases starting from December or even late in Hong Kong in February. And this time it's the same, back in November last year, people has been circulating some news about this and cannot be confirmed. And it's around this December, mid of December, started many talks and many conversation about this. And I personally got some consultation from the government talking about this. Is this a real issue, or is it a SARS, or is it something else? And in the last week of December, that the government almost decided this is serious problems and they have to take actions. So December 31st is a very critical day that government took a very important actions to perform on-board fever screening for passengers from Wuhan. I think it symbolized the alertness of Taiwan government and professionals in Taiwan. And so from January this year, we saw this epidemic evolve. So alertness through the experience of interacting with Chinese and the suspicious we always have in our mind. So this is a very important issue. More than that is after the SARS, the government, the professionals, the medical cycles, has worked together to build a very sound public health infrastructures. We have this very quick team inside this Taiwan CDC, and through the years they have been involved in intensive interactions with US CDC mainly, and some with the European CDCs. We are not part of a WHO, so we don't count on WHO very much. So we train these medical doctors, this infectious disease control specialist in the central government. And in the meantime, in local governments, also a very good grassroots, public health nurses. They are very good at investigations together with our physicians from Taiwan CDCs. So this actually is very important manpower that once you have some plan and there's a well-trained public health workers can execute. The other thing is the development of this biomedical industries in Taiwan, and they are more quick to respond to request from our societies in terms of diagnosis to treatment. So good manpower is very important for any country that you want to combat with this infectious diseases. And the other one is the democratic process actually play a very important role in this event. Starting from last year, because of students' revolt, society revolt in Hong Kong, that actually alert the whole society is very watchful for what happening in Hong Kong and in China, and the reactions of Chinese governments to forbid their citizens to come to Taiwan has prolonged the whole years, especially toward the end of the years. They even put more strict traveling to Taiwan, and so the exchange of person to persons in between Taiwan Strait has decreased significantly. So compared to our neighboring countries, this is kind of luck. We have so many business dealings and workers come and back and forth between Taiwan and China, and a lot of Chinese tourists. But in the past the last 6 months of the last years, this is very limited. So that's one of the luck we can do that. So so then after this presidential elections is even more tense. The relations between Taiwan and China is also tense. So what I'm trying to say is all this political environment actually in this time favor Taiwan to be more cautious and more luck to respond to this seemingly very unstoppable pandemic. So we can slow the epidemic curve quite a lot. I went back to check the history of SARS. That it took about 40 days from the first confirmed case in Taipei to spread to a hospital, the Heping Hospital. About 49 cases at that time. And if we counted the first cases in Taiwan this time, until now, it's also around 44 days. And we have today 49 cases, 1 death. So if you think about the scale of the problem we are facing now, it's almost unbelievable. How can we do that for past 2 months that we can achieve this? And there's as had been mentioned in earlier, Jason Wang has this article in JAMA talk about this the digital tracing, this national health insurance record to be linked with immigrations. They are very good of containment, the border control. By doing this, you can do micromanagement of many of these case traces, context traces in a very short time. And that's actually help our public health workers a lot to get their things done in a very short time. And so digital revolution is a very important tool for this infectious disease control in Taiwan's experience. And the command centers that has been authorized, there's power by the legislation we have established years. Step by step, we upgrade our command centers labels from 3 to 1, and the president has fully trust on our prime minister. They have a free hand to execute their powers in a very short time. So a lot of times is, early morning make decisions, and a lot of things can be out from the office and to be implemented. Sometimes 2 days later, So this quick response is very important. And again, it's after the presidential elections, the ruling party has very high. They win a lot. They won a lot, and they have a very good legitimacy to implement a lot of policies. That's also give our government a very good administrative power to implement their measures. So this is some kind of story I want to share with you, but there's those challenges ahead. As we has already seen, there's community spreading now in Taiwan. So the containment strategy is not enough now. We have to move to mitigations and move to some of this strategy we cannot think of. And as Boston is a place for a lot of students, and one of this strategy we have before, because years ago we have accepted a lot of Chinese students in our universities, many. So it's a big decision for government how to deal with them. So firstly, we don't allow that Wuhan students who come back right away, then later on expand it. And it's not without controversies, but if you are thinking of the education and infectious control, and both are very important. And but we did the right way, in the time of uncertainty, and that is a way we have to do. So I think that's a hard choice, but we did it. And but our universities are very innovative, and they are setting up some of these remote education mode by internet, by video. And so this is the first week we open classes, and we have no problem. Like I have a student who is in Japan, but he's from China, and he cannot come to the NTU to take the course, but we did it live, and it's very successful. So it would be better we take a epidemic serious, and as our top priority for the now, for the time being, and let's solve this difficult problem first, then probably we can move to another issues. So this kind of priority setting and values, and that Taiwan has adopted, it's very important when we are facing this new virus with a lot of unknowns and a lot of uncertainty, and everyone has to make hard choices, and I think we did the right things. And this is some of the lessons we took from SARS until now, and the SARS playbook we are using now quite good, and this I'm told my time is up, so probably for exactly what we are doing, and Professor Ling will give you more details. So Hsien-Ho, are you going to take the next one? Yeah, this is end of my talk. Can
Okay, can you hear me? Can you hear me?
Yes, down and clear.
Okay, thank you. Okay, I'm going to start. So first of all, thank you for the invitation. It is my honor to be back to Boston virtually, as I obtained 2 of my degrees in Harvard. So I'm going to pretty much follow what Deng-Chyang talked about in terms of response to the COVID-19 outbreak, but I'm giving more details with some of the examples of what we've been doing. So first of all, looking at the epidemic curve of the outbreak. So this is the number of confirmed cases by the report date. So the ones in purple are the imported cases, and the ones in orange and gray are the locally acquired cases. So we've somehow transitioned from a outbreak with mostly imported cases gradually to the locally transmitted cases, but not to a great degree. And the main that have been taken include the central command center and resource securing, reducing the impact of imported cases, reducing local transmission, and protecting the healthcare system. So I'm going to talk more about the first 3 points, and I believe the KMU, Kaohsiung Medical University, will give a very good example about the healthcare system. So as Deng-Chyang referred, on December 31st, Taiwan CDC reacted very quickly to this Wuhan outbreak. And by January 20th, the Central Epidemic Command Center, or the CECC, was set up. And then the following day, we observed the first case of COVID-19 in Taiwan. So this is the Central Epidemic Command Center, which is in charge of coordinating multiple sectors within the government. This is important because many of the efforts require this multilateral collaboration across sectors, not just within the Ministry of Health and Welfare. And the first task of this effort is that it's actually not directly related to the control of the disease, but to secure the supplies. So right after the first case of the COVID-19 in Taiwan, people are trying to buy face masks at every efforts. So on January 24th, the CECC decided to stop the export of the masks to other countries. And by January 28th, they decided to do centralized management of the masks. And the masks were released at the convenience stores because they are everywhere in the country. So the main purpose of the centralized management is to secure the supply to protect our healthcare professionals. But even that is not enough. So by February 6th, the government started this name-based rationing system for mass purchasing using the National Health Insurance affiliated pharmacies. And at the same time, the government has tried to increase rapidly the mass production from the baseline of 1.9 million to gradually to the expected 10 million by mid-March. So we will be the second largest mass producing country by that time in the world. So this is a picture of people lining up to buy face masks. So in response to the increasing demand and the information need to buy face masks, the National Health Insurance actually released the open data of the mask storage. And so they, for every 30 seconds, they updated the information about the mask provision in all pharmacies throughout the country. So up until now, there has been nearly 80 different apps or websites that make use of this open data. So every day, people can easily check where you can get the mask and what is the storage of the masks within a particular pharmacy. So this is one of the example of using the big data analytics. And all of that was made possible because of this National Health Insurance IC card. So usually we use this IC card to seek for medical care, but at this time we use this IC card to buy the face masks under this name-based system. So people can only get certain amount of face masks per IC card. And then the next task is to reduce the impact of imported cases, including the use of border control, home quarantine of returning residents from China and also from other countries. And this was assisted by electronic monitoring of the people requiring home quarantine. So essentially a mobile phone signal tracing was done, and even like this credit card tracing was done to find out whether the were staying at the quarantine places. And also there's travel history alert in medical information system. So again, this was done through the National Health Insurance card, never a person. So the way it was done is that the information of the entry, immigration, was linked to the National Health Insurance through the unique identification number. So every time a person went to a healthcare clinic or outpatient, if the person, it will pop out in the medical information system. This is an example of a person came back from China on January 17th. So that made the Diamond Princess cruise ship disembarked. So the cruise ship stopped at the Jong harbor in northern Taiwan on January 31st. And on that day, nearly 2,700 passengers entered Taiwan. And it was only later, after several days, that people realized there were suspected cases or in later confirmed cases of COVID-19. So in response to that, the government tried to reconstruct the travel routes for these passengers and rather quickly. So again, using this big data information of the mobile phone signal, so they identified 40-something different locations or hotspots that these passengers went on that day and during what time. And then they use this kind of central text message, cellular text message, to inform all the residents to be aware of these places. If they went to these places on that particular day, they should do the self-care management. And in terms of reducing local transmission, they use contact investigation and home isolation, as well as general social distancing measurements. So I'm giving two examples. So contact tracing and investigation was done extensively. So by the end of February 26, a total of more than 1,000 close contacts of the confirmed cases were identified. So in general, the secondary attack rates, symptomatic attack rate among those who have close contact was about 1%. So 1% had developed disease. And we found that household and family members were at the greatest risk. And importantly, it seems that exposure early in the course of the disease was very important compared to the exposure that happened later in the course of the disease. And the attack rate seemed to increase with increasing age of the contacts. So this kind of information will provide critical information for the policymakers to direct their efforts for further contact tracing and resource allocation. And another thing is with regard to the mass gathering activities. So in Taiwan, there's a very important traditional event called the Mazu Detour. So Mazu is the most popular goddess in traditional Taiwan. So every March, up to over 1 million people will gather to this very famous Mazu temple for a period of 9 days. So many of them will live together, eat together, and sleep together for this important event. And it was quickly realized that this kind of mass gathering would be a real challenge to an outbreak control. But at the same time, because this event is so important to the society or to the tradition, so that the government did not want to directly stop the event. So there was a lot of negotiation, or even the public opinion that was behind this discussion. So fortunately, about a week ago, the director of the Temple Association decided and announced that this important event will be postponed. So having gone through all these important interventions, the big question is maybe, did all these interventions work? The answer is I don't know for sure, but it seems that if you look at the epidemic curve, counterfactually, if we look at compare with what happens in other countries, it seems that the rise of the number of cases has been relatively slow compared to other countries. And another point of evidence is probably looking at what happened with the flu. So this year we actually have a quite bad flu season at the beginning, but in the past 4 to 5 weeks, so the number in red, the red bars here, is the number of confirmed flu cases. So the number of confirmed severe flu cases has actually dropped down very quickly, and we actually are claiming the end of the flu season in this week. So that's probably another indirect evidence that all these kind of interventions may have some effect on respiratory infectious diseases. So maybe an even more challenging question is, among these many different action items, what worked and what didn't? So the answer is probably impossible to tease out because we have done at least 124 action items over the past 5 weeks. So this was the appendix of the paper that we just talked about, published by Jason Wong in JAMA. And you can read the paper for more details. So lastly, I just want to conclude that, so Taiwan is like a baseball. So if you take the analogy of baseball game, I think we're still in the first inning of the ball game. We're doing okay right now, but it's going to be a very long battle, and there's no time to relax. So I think we should keep our hard work and try to fight throughout this game. So this is my quick presentation. Thank you.
Thank you, Dr. Jong and Dr. Lin. We will now open up the floor to any questions you might want to address the two speakers.
Dr. Lin and Dr. Are there any guesstimate regarding how many carriers, asymptomatic carriers can we find today?
Yes, so our colleague, the Associate Dean of the College of Public Health, Associate Dean Tony Chen, I think their team has done an estimate of the underreported or sort of the latent carriers of the disease in the country. Yeah.
Thank you, doctors, for a wonderful talk. I'm curious from your perspective what other countries can learn from the Taiwan's experience. Thank you.
Deng-Chyang?
Dr. Jong and Dr. Lin, did you hear the question? The question was, to recap, correct me if I'm wrong, whether or not, from your perspective, what can be learned for other countries, according to what's going on in Taiwan right now. Did you hear the questions, Dr. Jong?
Yeah, it's on and off. Yeah, that's. Can you repeat again? What?
Okay.
Jenna, can you hear the question and you can answer? I can't.
Okay, let me repeat the question again. From your perspective, what do you think other countries can learn from Taiwan's experience with this outbreak?
Oh, you know, it's one lesson is you have to based on science. You know, listen to the scientist and looking for the data. You know, and also have a broader framework and on what you are planning to do. And also the alertness, the awareness. You know, in the beginning, people are kind of arguing and later joking about the masks dispute or controversy. And but if people are so care about this masks they have, it's kind of awareness make the whole society very keen on the development of COVID-19. So the mass media's coverage on this issue is so huge. It's minutes by minutes that a lot of report and people actually getting that. And sometimes you think it would be overwhelmed, but I think this openness of reporting and news, not only in Taiwan, in Korea, in Italy, you know, even in US, we got this kind of news very fast. The whole society knows about it and that. So if the society is not open enough, they're better to open up. This is very good to face the virus threat. And the other way is, you know, that the hospitals, the physicians and nurses, they're very important and have to support them. And our society now, you know, very supportive of our medical professionals. And you know, Hsien-Ho has mentioned that the distribution of the mask through the pharmacies. So pharmacists are mobilized. It's the first time we have for this kind of pharmacists in the community. They are heavily involved in infectious control. So I think that's all the country, if you have some basic infrastructures of your medical professionals, associations, drugstore, etc., have to organize them together and try to use the mobile phone we have now. Try to think what kind of social medias each society has. That's would be very powerful to do risk communication, to do tracings. So this what Taiwan can lessons can give the other countries.
May I just ask another question? In the democratic society, I thought that Taiwan has a very good privacy protection law. Now, when you have this IC data indicating a person's travel history, under the existing law, I know it's very good public health practice, but under the existing law, is that a violation of that individual privacy?
Yeah, I know the issues, and the government is very cautious of this, and they know they are walking a very tight line on. They will not be too aggressive of intruding the privacies, and but the society actually are very supportive because it's the threat we are facing until now, and they are very good tools for the society to fight the virus threat, and we have not learned complaints yet for this kind of uses, but eventually this should be will be discussed further by whether what kind of information can be used, and that's a new phenomenon that Taiwan is very pro this privacies, and for the time being, and we are facing this even greater threat, so people can sacrifice a little bit and to be protective.